Income Texans could face big changes at the doctor's office as the state takes the next step in battling a historic budget shortfall. KXAN political reporter Josh Hinkle looks in depth at the fallout of the major health care decision.
At Austin Bone and Joint Clinic, Dr. Bruce Malone sees his fair share of low-income patients.
Severe post-traumatic arthritis of the hip.
Most are elderly and fall into a category called dual eligible.
It's going to require a hip replacement.
There are about 330,000 Texans who now qualify for both Medicare and Medicaid because of their age and income. The state wants to take Medicaid out of the picture for those clients, a move Malone says could severely hurt his practice.
If I decided I was going to restrict my practice to those patients and provide a service, I couldn't keep my doors open.
By eliminating Medicaid, the state would save about $1.1 billion, giving doctors one of two options: pay the void Medicaid left behind or turn those patients away.
And the question is, can those doctors continue to serve the patients in their community without that money?
Malone, who's also president of the Texas Medical Association, says patients who live in rural areas where there aren't a lot of doctors will suffer the most. Others at risk include inner city, older, and nursing home residents.
It would take a dramatic turnaround to sort of get us out of the Medicaid hole. It's a program that is so large and is growing at such a fast pace that we're always looking for how do you start to rein in those costs? How do you try to use the dollars more wisely?
The Health and Human Services Commission plans to meet with Malone's group next week to reconsider this drastic change.
Do we need to tweak this policy? Do we need to exempt certain kinds of providers to make sure that they're not taking more of a hit than others?
Regardless, the plan will go into effect on January 1st before that meeting even takes place. Still, Malone says he has hope the state will eventually see the urgent need to ease up on these low-income cuts.
No Medicare, no Medicaid, which would be a disaster.
In Central Austin, Josh Hinkle, KXAN News.